Good evening. Welcome to Conversations with Candidates. It's a joint production of Oregon Physicians for a National Health Program and the City Club of Portland. I'm John Stride, the City Club Board of Governors Secretary for this year. The City Club has over 100 years of history producing research and public events to help Portlanders make informed decisions about public policy. You can learn more about the City Club and become a member yourself by visiting pdxcityclub.org. The City Club maintains a nonpartisan approach to policy. We're faithful to that approach in our participation here. It is beyond argument that the healthcare system in the United States is suboptimal. It costs more, is less accessible, and delivers worse healthcare outcomes than in other industrialized nations. Healthcare is personal to nearly all Oregonians. Congressional candidates' views on our healthcare system is an important consideration for Oregon voters. While the City Club does not endorse specific candidates and has not taken a position on specific healthcare policies, we are pleased to co-sponsor this opportunity for candidates to present their perspectives on healthcare policy to Oregon voters. We thank Jamie McLeod-Skinner, candidate for Oregon's Congressional District 5, who graciously consented to talk about healthcare policy tonight. Now it is my pleasure to introduce Peter Marr of Oregon Physicians for a National Health Program, our moderator for tonight. Welcome, Peter.
Thank you, John. Good evening. I'm Dr. Marr. I'm a member of Oregon Physicians for a National Health Program, or PNHP. We advocate for single-payer healthcare, also known as Medicare for All. Our website address is www.pnhporegon.org. Thank you for joining our Conversations with Candidates 2024 speaker series, in which we offer Oregon candidates for elected office an opportunity to talk healthcare. Before I introduce tonight's speaker, Jamie McLeod-Skinner, I'd like to tell you about single payer and why we at PNHP advocate for it. Americans and Oregonians pay twice as much for healthcare as people in other developed nations. Yet our healthcare outcomes are at the bottom of the civilized world. Americans pay more money, get less care, and cover fewer people than any other nation. We believe any healthcare policy in our state or country should achieve 3 goals. 1, everyone can access care when they need it. 2, total costs are lower. And 3, health outcomes are better. The bumper sticker version is better care to more people, less money. Across the world, there are examples of health systems that achieve all 3. What all these successful systems have in common is everyone is included, everyone enjoys a single comprehensive benefit package, and any patient can see any provider. The most efficient model of doing this is a single payer system, publicly financed, privately delivered, universal health. However, not everyone agrees with this. To allow you, our audience, to hear different perspectives on this challenge, we invited candidates from major parties who are running for one of their Oregon's contested congressional districts to explain how they think about healthcare and what policies they endorse. Please note that a candidate's appearance in our series does not constitute either their endorsement of single payer or endorsement of any candidate by Oregon PNHP or the City Club. Tonight, we are honored to have Jamie McLeod-Skinner to represent Congressional District 5, sharing her thoughts about healthcare at this evening's session of Conversations with 2024. After she speaks for about 20 minutes, we will have question and answer sessions for the rest of the hour. My role as moderator will be to facilitate the conversation between the candidate and you, the audience. Please feel free to chat with others in the audience using the chat function at the bottom of the screen. To submit questions for the candidate, please submit your written questions using the Q&A button. I will ask as many questions as time permits. Please keep your questions courteous and pertinent. At the end of tonight's session, you will have the opportunity to answer a questionnaire about your experience tonight. Jamie, thank you for joining us, and the mic is yours.
Well, thank you so much to PNHP and to City Club for hosting this really important discussion on how we catch up to other industrialized nations and ensuring everyone has healthcare. COVID revealed the vulnerability of our systems, and healthcare is really at a breaking point. And so also a very special thank you to all the healthcare professionals who are getting us through COVID, this once in a 100-year pandemic, but this ongoing struggle that we're having with it. And that's everyone from doctors to nurses to aides and assistants, techs, and janitors, because the cleanliness and cleaning up after COVID is just so critically important. So I really appreciate the opportunity to have this discussion. I'd like to take my time to introduce myself a bit, share my big picture perspective on public health and approach to problem solving, and then talk healthcare specifically and also really look forward to your questions. So a bit of background on me. My family, I come from proud working family roots. My grandparents were union factory workers. My grandfather built trains and built tractors. My single mom would get up early to drive a school bus, to teach all day. I drive a school bus home. In the summers, she was a farm worker, and that's how she fed my brother and I. And my aunt was actually a nurse. As a child, I actually lived in the Midwest, in East Africa, and in Southern Oregon. So I'm a proud product of Oregon Public Schools. And some of my own experiences with access, or actually without access to healthcare, was when I was a child in East Africa. I almost died from a very severe bout of malaria. And the hygiene was so poor at the main hospital that my mom was actually afraid to take me to the hospital. Thus, my shout out to janitors who helped to keep those facilities clean. And had the clinic that my mom was able to take me to not received the IVs that I needed the day before, you would have a different speaker tonight. When I was in high school in Oregon, again, my family at that point was, we didn't have a lot of means. And my graduation gift from high school was a week at the Steens Mountain Running Camp. I was a runner back then, I was an athlete. I came back in the best shape of my life, and I was working out with my soccer teammates before going off to college. And I ended up injuring my knee. And because I knew my mom couldn't afford to address the issue, I just kind of, toughed it out. And it didn't find out for a year that I actually torn my ACL. I spent that year actually up at Lewis and Clark, my first year of college, which is actually in the 5th Congressional District. But I actually transferred, went on to get degrees in civil engineering from Rensselaer Polytechnic Institute, from Cornell University with a master's in regional planning. My thesis actually focused on protecting local ag economy while also protecting water, because the city that the water flowed to did not filter its water. So public health issues have been something I've worked on for a large part of my career. And then after working in different fields for several years, came back to Oregon, got my law degree focused on water law and Indian law. And that's my professional background. Leadership work I've done is, I've got a leadership certificate from Harvard University for state and local elected officials, Oxford, a certificate in human rights with a focus on protecting human rights. Ethics is really important to me, and I also went through the Santa Clara University Markula Center for Ethics for Applied Ethics for elected officials. All of these things are key, I think, to good public policy, understanding issues, and actually helping to address and solve issues. I began my public service over in Bosnia and Kosovo just after the war. I did not serve in uniform. I'd come out as a young adult, and back then you could not serve in the military if you were out. So I worked for a humanitarian organization, and I managed the reconstruction of schools and hospitals in war-torn areas. And so worked very closely with medical professionals who were struggling to provide basic services in shelled out buildings with limited supplies and without basic water and sanitation. So, returned to the U.S., led refugee resettlement, which also worked on unique healthcare issues that some of the folks we served were dealing with, coming to the States and integrating into the U.S. system. I've worked in local government at the local and regional levels on water resources and housing as a staff city manager, and also as an elected policymaker. And led wildfire recovery in Southern Oregon after the terrible wildfires that we have, and the public health issues that came out from that environmental catastrophe. Also work in natural resource management, affordable housing, education policy, and community resilience building. I currently serve you all on the Oregon Watershed Enhancement Board, focused on environmental health and watershed health, and then also have served on the Jefferson County Education Service District Board. And I say these things because I really think of healthcare policy as it goes beyond just healthcare, really public health, and that approach to caring for our resources and seeing how many of those systems are connected. And I think that's critically important. I will also say that having lived and worked in countries who are both at war and in post-war, understanding the importance and fragility of our democracy is, I think, part of the discussion as well. So not directly related to provision of healthcare, but we need a functional government to be able to have a healthy healthcare system. And part of that is having leaders who can work together to solve problems. I believe our politics needs to be solution oriented, and my success in purple areas, and my wife and I live in rural Central Oregon, is really based on this approach of bringing people together across our divides to focus on the challenges that we're facing and solving problems. And part of that is not using buzzwords. And I've noticed that, especially in healthcare discussions, I've had some really interesting conversations with folks across the state, including people in very rural areas, folks who identify as very conservative, who, when we use buzzwords talking about making sure everyone has health care, will respond negatively to some of those buzzwords, some of the terms, some of the names we use. But at the same time, when we engaged in conversation and I asked him, well, what kind of health care do you want for your family and your community? He essentially described what many would refer to as Medicare for all. And so I find that when we talk about ideas, that's how we connect, and that's how we understand that and address the joint challenges that we're facing. I've had the good fortune of learning from and working with folks across our state, and the stories I've heard, stories related to public health, would both break your heart and also motivate you to really come together to make sure we move forward on addressing what is now not a fully functional system for not just all Oregonians, although Oregon is a leader in many ways, but really for folks across our country. I've had the good fortune of learning from a student working in Oregon City, a high school student who's working with his peers on mental health policy and behavioral health issues. And his perspective is really informative in my sense of the policy we need to move forward on, and this is just one of those key areas. I mean, the volunteer work I've done with farm workers, seeing the health impact of pesticide use. Remember a woman in rural Central Oregon who talked about how critical healthcare was to her family. They had to put their family farm on the market because her mom needed care, and that farm had been their family for 3 generations, but they couldn't deny their mom. And so they were facing bankruptcy because of inadequate access to healthcare. There's some great work going on again around our state. Clackamas County has a free clinic that's doing amazing work for folks who don't have access to many other systems in place, the healthcare systems, folks who are documented and undocumented, houseless people. And so getting the resources and providing the support necessary to do the work of our communities. Because again, this bigger picture perspective, if people don't have some of this basic care provided, we see impacts in other ways. Our communities bear costs in other ways. There also just an awareness of friends who only have access to Indian Health Services have pointed out to me that even prior to the overturning of Roe v. Wade, they didn't have access to abortion health care. So understanding the realities of folks throughout our state, throughout our country, I think is a really key part of these conversations. The mom I met in Clackamas County who lost her son to a fentanyl overdose, understanding these crises, and kudos to the governor and others who just announced and declared a fentanyl emergency in Oregon, and the leaning into addressing this challenge is critical right now. A woman I met in Albany who's struggling with Parkinson's, and because of the increased cost of the medication, she is getting out less because she can't afford the medication she needs to be able to enable her to go into spend more time in her community. And that also speaks to the importance of policymakers being accountable to people And I appreciate pharmaceutical companies and all the work they do in creating pharmaceuticals, but we also ultimately, I believe, need policymakers who are accountable to people and are able to negotiate and pressure pharmaceuticals not to be driving up prices. So things like having Medicare negotiate prescription drug costs, going beyond insulin, which is a great first step, but making sure that drugs are affordable is really, really important. I proudly don't take corporate PAC money because I believe in being accountable to Oregonians and to people who need advocates in government. So my big picture philosophy on government is really that government's role is to provide safe and healthy communities where people and families can thrive. And that means responsible stewardship of our limited public resources so that we can invest in this work and be accountable to people. I was first elected to office 20 years ago to a city council, and I've always said I don't believe in spending public money. I believe in investing it. And so whether we're talking about education or healthcare or natural resource protection or our local economies, making sure that we're investing in the people who are able to thrive in our communities. Frankly, I also believe that government needs to know when to help out, when to get out of the way. And when it comes to ensuring that we all have access to healthcare and affordable healthcare and accessible healthcare, especially for rural folks, government has the role of helping out. When it comes to making decisions about things like abortion healthcare and reproductive choice, government needs to get out of the way. And so those dual roles, I think, are critically important. Again, my big picture perspective on healthcare really is through a public health approach lens. So healthcare specifically is just part of our overall public health. And public health is impacted when our basic needs aren't being met. And we're seeing this right now in Oregon, the crisis with inadequate housing, inadequate affordable housing, food security, which of course means both a sufficient supply of food, but also healthy food. And I'm really proud of work that local farmers are doing throughout our state, but especially here in Central Oregon, to have farm-to-table programs to address the spike in food insecurity that we've seen, especially with reduction in SNAP programs, and the need to move the Farm Bill forward and get that passed. Access to things like transportation and inadequate childcare also impacts overall public health. Family and community relationships, especially since COVID, we're seeing from young people, from seniors, but really across the board, behavioral health and support. And we don't have a fully integrated system and a support system necessary. We don't have some of the staffing necessary to do that work. Public health is impacted also when our personal safety is at risk and those ongoing stresses. One of the incredibly informative documentary I've read, and I strongly encourage it to healthcare providers if you haven't. It's called Unnatural Causes, and it's not a sponsorship. It's a thing it's a documentary I want to mention because it talks about how racial and socioeconomic inequities impact public health, creating greater vulnerabilities and those stresses, those daily stresses on us, making us more vulnerable to health impacts. There's also, of course, with the climate crisis, the impacts we're seeing on environmental health from the ice storms we just saw and heat waves. Think of our farm workers working in fields and having to deal with the heat domes that we're seeing. We've lost people. People have literally died in the field because of those stresses to our bodies. Air and water quality. Again, I have a great love for talking about water issues. And so those are a key part of health, our overall public health system. And of course, any discussion about healthcare and public health really starts with people, those providing the services. So we need to make sure that we have people who are fully trained and who are supported in doing their work. And it's crazy that we have healthcare providers who don't themselves have adequate healthcare, but are also dealing with staffing loads and dealing with pressures that do not enable them to do the work they love of taking care of people. We need to do a better job at that. And I really appreciate all the experts that I've learned from. I've mentioned a couple, but from policy experts to the medical professionals, frontline medical staff, the youth leaders I've mentioned that are supporting their peers, patients, family members of patients, and the things, their individual perspectives, they're all frontline experts. And learning from the experts as a policymaker is critically important, understanding that perspective. I've talked to too many nurses who are just struggling so much from, burnout and not having the adequate resource and support they need to care for their families while they care for others. Care for the caregiver is a real key concept that we need to make sure we lean into to make sure we're providing a good system and helping the people who are providing great healthcare and public health in our communities. And frankly, politics is often getting in the way of that shared goal that we really have. So when it comes to healthcare, my core philosophy is everyone has access to physical and behavioral, mental health, behavioral health, dental, vision. And when I say access, I mean affordability, but I also mean that physical proximity. The word access is really important to those living in rural areas because so many times, if something happens to you and you're in a real remote area, getting proximity access to healthcare is critical. And I believe there's really no excuse for being the only industrialized nation not providing healthcare to all those who live in our country. It's shameful. And yes, there are challenges to doing that. But I had a professor once told me all the easy problems are solved, but that's why we need leaders who will really lean into solving and working on these problems. In terms of the existing models that we have, there's other countries we can be learning from, whether it's Germany and Canada having those dual systems that I think allow us to bridge a lot of the divides in these discussions, but also they're looking at 10% of their GDP. We're looking at almost twice that in terms of what we're spending. And so those models are out there. In allowing employers to negotiate more extended coverage. So having those dual systems I know is really important to some folks. And then also the language we use. I was talking to someone and talking about social determinants of health, and I know that's been a part of the conversation for a long time. But she was pointing out that now talk more about health opportunities for everyone and resiliency, because now social determinants for health has sometimes becomes a buzzword that gets in the way of moving the conversation forward. So we need to focus on ideas, and we need to find the way to move these ideas forward throughout the political maze that we find ourselves in. Because the bottom line is, if we invest in healthcare, and especially things like preventative healthcare, it's pennies on the dollar. We not only save people pain and discomfort, we save money, and we prevent other problems and other costs that we bear without doing that work. And the classic example is if an emergency room is your first and last resort, as it is for many folks who are houseless, it drives down the costs of quality of life, and it drives up the cost of healthcare. So, again, COVID has proven how vulnerable our system is. And so we need to improve our overall health. And so those goals of better access and better outcomes and lower costs, we know there's models out there so we can do it. We just need to build up that political will to actually get it done. I also believe we need to better, not just improve the system, but better integrate our systems. Just one example is public safety and mental health care. And there's programs like in Eugene, they've got the CAHOOTS program, where you have public safety officers who are often the first called when there's a behavioral health challenge, and having behavioral health specialists there allow them to address the situation more effectively and more appropriately. Models like value-based care, so where providers are paid based on outcomes rather than just the traditional fee-for-service. I think these are really important conversations to have to challenge us to do better in our systems. And then, of course, improving access, things like telehealth. So rural broadband has been a big issue for a long time as part of our infrastructure. It's also key to providing healthcare in many key areas. So those opportunities for improvement, I think, are real great opportunities to continue this conversation. And I, again, look forward to the questions. But one thing I just want to come back to, and I touched on it briefly, is access to abortion healthcare. It is essential to protecting our fundamental rights. And this is personal for me. My wife, and she's given me permission to tell this story. Many years ago, she had a miscarriage and was bleeding out. And had she not had access to an abortion, she would have died. And the fact that we've got politicians preventing access to abortion health care is not only unconscionable. Frankly, it's also practicing medicine without a license. They're taking away the ability of doctors to protect the health of their patients and taking away the decision from women about their own health care, about access to abortion health care. And frankly, is practicing medicine without a license, and that's committing a crime. And I frankly believe should be prosecuted for medical malpractice. I also believe we should just provide that as a fundamental right. But I also think it's more than just a political discussion. It is an attack on people's health care. And with that, I look forward to your questions.
Thank you so much, Jamie. I want to give a reminder to the audience that we really look forward to your questions. In order to submit the questions, please use the Q&A button on your screen. Please do not use the chat function. Please use the Q&A method. We'll get to as many questions as we can. Thank you so much. The first question is, Jamie, if elected, how will you quickly become an expert on your elected committee's policies and objectives? And how will you build support among relevant stakeholders, both familiar and unfamiliar?
Yeah, well, the first is to listen to the experts. And as I mentioned before, when I think of experts, I think of everyone from policy experts to the frontline staff providing the services, to the healthcare professionals, to also those who have experience with the system. Everyone who has interfaced with the system it has an expertise that is an important part of the discussion. So the big picture policy, having a sense of what are some of those major changes we can make. Also, sometimes there's those smaller changes we can make, is a really key part of understanding the big picture, having a long-term vision, but also ultimately moving forward. And sometimes you can take big steps, and sometimes you take smaller steps in the long path forward. The other piece about building relationships, I mentioned I was first elected to a city council, to public office 20 years ago. And I had the actual good fortune of being in the political minority, because what you learn when you're in that situation, it really forces you to learn how to engage with your colleagues and learn how to learn politics and learn how to learn statesmanship. And when you build up those relationships and you're also able to talk about ideas and understand your colleagues and what their goals are and show an alignment and try to build that alignment with goals, is how you are effective in moving things forward. I think the biggest disadvantage to folks who step into a role, whether they're in the majority or the minority politically, is not having that experience of being in the political minority. If you haven't been there, you don't understand how to effectively move things forward. And especially in a place as complicated as Congress, with complicated in terms of all the different issues that are coming at you, you have to have those skills, and you have to have that savvy and that understanding. And also being a rural Democrat, relationships are key. And so having that approach is something that's allowed me to be very successful. Even when I was elected to an education service district board in Central Oregon, again, a political minority, was able to move forward some really key issues, including issues around equal access and social justice and equity, with some very conservative colleagues, respected colleagues, because we talked about how we were taking care of our kids and how we were focused on the needs of our kids. And by using language that is accessible and leading with ideas, and then also doing the hard work behind the scenes. I'm a student of, I'm proud of my hard work ethic, and that's how you learn, and then also how you actually practice the art of politics is how you get things done. Just Peter, I apologize, you're on mute.
I knew I would do that at least once.
I thought this was a test of lip reading. I do not lip read, so.
Thank you for the reminder. Our next question is, what are the economic and social benefits of a national health care program?
Well, multiple. And even in the intro, you touched on many of the key overarching ones, but essentially making sure everyone has access to healthcare by addressing, using that public health lens and making sure people get the care they need, the preventative care, and get the care they need early on. It allows people to have a higher quality of life. It decreases costs. it also prevents or limits impacts in other areas. So for example, I gave the example on behavioral health and the partnership with public safety. Public safety costs and also tragic results that can result from public safety officers who may not have the behavioral health training engaging with someone who's having a behavioral health crisis. We see problems, we incur costs, and there are sometimes very tragic consequences to not having some of those systems that are integrated. So whether, the importance of doing this is that you can argue it from many different angles. You can talk about from an economic standpoint that if we have folks who are more healthy, they're more engaged, our workforce is stronger or more effective and more productive. So whether it's those quality of life issues, whether it's limiting the costs that families are bearing and enabling families to be more effective and families to thrive, there are so many from that big picture perspective, but also from the individual family perspective, there's so many net benefits. And it's when you look at it from that perspective, I think while there will be some costs, there will be some challenges to making some additional transitions. There's an overall benefit that the country economically, socially will benefit from. Sorry, Peter, you're on mute again.
Sorry. The next question from the audience is, what's the best way to lower costs, improve quality, and expand access to health?
Well, and this does start with a conversation with experts who can come in and talk details, but generally speaking, this is something from the Oregon Joint Task Force on Universal Healthcare. It talked about the cost and complexity and the equitable access being some of the biggest challenges we have here in Oregon, but really across the country. And so being able to work on those steps that can reduce costs, and some of those details will be addressing addressing inefficiencies is a good first step. So inefficiencies, from what I've seen, we're talking about 25%. If we improve that, we can bring down costs and thus expand access and care. We have those efficiencies in provider billing, in the high rate of private healthcare insurance overhead, and if we look back to, again, Oregon's done a great job. It is ahead of the curve on this. But there are, if you look at former Governor Kitzhaber's, his vision that he brought as a healthcare provider and the push for the coordinated care organizations, that model of integrating services is a really powerful one. And, there's some really great concepts that are out there. Again, Oregon has been a leader on this, of the integration of public health and resilience center approach. So almost a one-stop shop. And back when I was a city planner, we used to do this for folks working on development, but we can do the same for healthcare, where we're looking at integration of bringing someone in, identifying the needs and the challenges that they're having, from housing to legal services to the psychosocial needs that families are addressing. I've had some great conversations with educators, and they're talking about schools being essentially resilience centers and resilience hubs. Some of the work I'm doing right now in helping out the state and building up resilience, and this is an investment that our state's been making, is leaning into resilience centers in our communities. And some of those are targeted more on responses when there's an environmental crisis, but human resiliency also addresses healthcare, that physical healthcare, but also that behavioral and that mental health care as well. And developing those systems and using those three pillars that former Governor Kitzhaber had laid out, I think is a really good model and approach.
Thank you. You've talked a lot about mental health care and access to mental health care. This question addresses that. It says, how will you provide for expanding mental health care access in Oregon and nationally?
Well, one of the big challenges we have is not having enough providers. And then also our systems are not as well integrated. And again, this is what I've heard from those who are providing mental health care in the field, making sure that mental health care, behavioral health care is seen as a fundamental part of our healthcare system, that it is not an added part, it is fundamental and integral to that system is first and foremost. But also, addressing things like the taboos of obtaining care, education about resources that are available. So first making them available, but then also making sure that people know about them. When I mentioned the student leader, a high school student who's also on the youth advisory committee in Oregon City. And I asked him this specifically because he's doing a lot of work with his peers. And I asked him what the biggest needs were. I also asked what most people don't understand about what his peers are experiencing. And then also, I love always asking the magic wand question. If you had a magic wand, what would you change? So again, turning to an expert on this because it's my job as a policymaker to listen to experts and to move things forward in the areas that are needed. He talked about just that there's not enough mental health support. And also, even when there was available, they didn't know where to find it. And that's been a real frustration that his peers have had. In terms of not, when I asked, what do most people not understand about what you and your peers are facing? He said especially older folks, and I think he was talking probably to a lot of people who are listening on this. He said there's that rhetoric of, toughen up, or even he referred to toxic masculinity in the sense that people shouldn't feel like they can access it. And that the importance of creating safe space for people to access it. And again, this is his term and his expression when talking to his peers, saying it was not manlike or guys couldn't express their feelings. And, maybe it is easier for women, or there's less social stigma to access, but that's important to understand, and asking those questions and learning about that, and then trying to find out how to better access. I know in talking to veterans, I've especially on behavioral health and mental health, it was the feedback I've received is we need people who are professionals who understand our experience. And even back when I was working with refugees, I would bring in a mental health care provider. It was seen as kind of novelty then, but you come out of a war environment, it's a very intense experience, and part of survivability and adaptability and resilience is being able to address that experience. And I remember the mental health care professional I worked with, her favorite question was to when she would talk to folks, especially who would come from, she would typically see that it would be men who would say, well, I'm not crazy, I don't need mental health care. And she would always say, you've just come out of a crazy situation. War is crazy. Only crazy people are not affected by a crazy situation. And that was the way she was able to get access to folks who were otherwise felt too proud or felt that there was shame associated with getting access to behavioral health and mental health. And people could really lean into it and gain that benefit. And then just lastly, on the magic wand question, when I asked Miles about the magic wand, he talked about how he talked actually personally about his family and wanting to make sure his family had access, and how there was that perception, that public perception, again, that barrier of not getting access. So whether it's talking to youth, seniors, especially coming out of COVID, have felt really isolated, and it's people don't talk about it initially, but when you engage in the conversation, then it starts to come out, and people are feeling really lonely and really vulnerable in this area. And so I think more than ever, addressing mental health, taking the stigma out of it, providing support for it, seeing it as a part of our being healthy and having healthy communities is, I think, critically important at this time. And then just the last point in terms of where I started on having enough staffing and enough support to do this work. I've proposed a civilian GI Bill that would be for professions, especially in the healthcare profession, education, many others, where someone could essentially go to college, go to their professional degree for free. They would sign a promissory note up front. They would be able to go through, get the education, and then go and serve in an area where they're needed for their profession. And I think that way of making sure we're building up the pipeline, providing support and the professional experience to folks, and serving those communities who are struggling at getting the help they need. I think that's all part of addressing this and other healthcare issues as well.
Our next question from the audience is, should people who take care of themselves have better, have better access to taxpayer-funded care than people who neglect their own health?
So you're talking about preventative health. You know, having incentives for preventative health, encouraging people to do. We know a lot of healthcare providers actually do this because it lowers costs when you address things ahead of time. You know, I think they're providing incentives is a great way to do it. We often, in public policymakers are torn between the carrot and the stick approach. And so using that as an incentive, I think is a great idea. Again, we do see this in many programs now where there's incentives provided, or other compensation that's provided. But as we look at an overall healthcare system, I think providing incentives for preventative health makes a tremendous amount of sense. It also, you know, just one example, again, we were talking about mental health and behavioral health. There are a lot of folks who take great pride in their work ethic. I do, many of us do, and making sure that work ethic, you still get incentives to make sure you're caring for yourself as you're doing that work. Those are opportunities for us to make sure that we're sustaining ourselves, sustaining our families, sustaining our communities in the long run. So yeah, I think it's a great idea, but I think it's part of that bigger picture of preventative health.
Thank you. You've also spoken a lot about living in rural areas and supporting people in rural areas. So this next question goes to that. It says, how can we get healthcare to rural patients who are far from any hospital or clinic?
Well, telehealth, as I mentioned, is one of those key pieces. Also making sure we have the resources that are close enough. So in Central Oregon, with Bend, there's some great facilities in the southern part. So I'm now talking on the eastern side of the Cascades. If you go south, Klamath Falls has some great facilities. In Hood River, there's some great medical facilities there. We're seeing a lot of challenges of healthcare centers closing down in more rural areas, but there's also some great models. So if you go to Enterprise in Wallowa County, and I was able to, a couple of years ago, tour that facility, phenomenal just-in-time service and really creative models that are being used. I think on a national level, we first of all encourage some of the and incentivize some of the creativity. Again, this is a lot of the work that Oregon has done through 1115 waivers and others, utilized opportunities to really expand creativity, but then also reward that creativity and then use those models to expand nationally. So we've got those opportunities across the state, but then transportation to those facilities, making sure that the healthcare is affordable and those resources are provided. We've actually got a friend who lives out on the coast whose father needed medical help and had to travel literally around the state to find a place where there was sufficient access. And so making sure that we have those facilities as needed and those resources are provided. That's a really key piece.
Thank you. Next question from the audience is, private equity firms are turning healthcare into owner-oriented profit center. How can we defend healthcare providers from this threat?
Yeah, well, I think it goes back to that concept of everyone needs to have access to healthcare, and we need to have a system in place that where healthcare is provided across the spectrum. We're addressing some of those additional costs and de-incentivizing some of the ways to limit access and create barriers to accessing healthcare. I mean, if you looking back to clarifying the point about helping people who are providing who have better access to healthcare. I mean, healthcare is a human right across the board, and so figuring out how to provide those resources, how to provide that care where it's needed, is really the charge and the challenge to us. And so as there are barriers, and there are barriers because there's financial incentives to create some of these barriers. Those need to be addressed. I mean, those are some of the tougher questions on a policy standpoint of breaking down those barriers and holding accountable those who are creating them. And yeah, it's yeah, I think also just making sure that making sure that we have the licensing in place that creates those requirements and make sure that people are protected through those processes, I think is also really key.
Okay. The next question is, if elected, would you support and or co-sign the National Medicare bill? The National Medicare for All bill?
So here's what I would do. I would set the standard and I would challenge anyone to beat it. From what I've seen and what I've researched, I really believe the Medicare for All standard that it sets is really the standard that allows us to achieve those better access. And I also think access to not just that physical, mental, but dental and visual is really important. So I think that is the goal that we need to seek. That's something I greatly support. I also, as I mentioned earlier, I think that the systems that we have, we look at Germany and we look at Canada with a public-private partnership. I think those are great models as well. But we do have to move forward, and we do have to establish and achieve those goals and make sure everyone has healthcare. We reduce the cost and provide access. And in that debate, so I would say we need to move forward on this. And in that debate, the challenge is who can provide better care at a more affordable rate that covers everyone and allows negotiation for some folks who are some organizations who want to provide some of those specialty services or provide additional resources. But that baseline of care, I think, is essential and something I strongly support.
Okay, thank you. We're getting there. We're moving along. Thank you, everybody. Thank you to the audience. These are great questions. I want to remind people we still have time to enter questions into the Q&A button on your screen. You have about 10 minutes, so please continue to insert your question. Thank you so much. Our next question is, should Medicare be able to negotiate drug prices? If so, how will we sustain medical research if drug companies get less money?
Yeah, I love this question. I think it's very, very important that Medicare is able to negotiate prescription drug prices. And we've seen this, that Congress has already moved forward with this on a step for just insulin. But this is true across the board. I mentioned the example of a woman I met in Albany who's struggling with Parkinson's, and she cannot get access. She cannot afford the medication she needs to be able to live her life in a way that she can if she had sufficient care. I do appreciate the concern that's raised about making sure that pharmaceutical companies can continue the research, but it's fair to, in the cost, include R&D as well as the cost of manufacturing and shipping and all those things. That's part of the fair cost that can be negotiated. So that, I believe, is already incorporated or can be incorporated in the negotiation. What we're seeing instead, without having someone like Medicare to be able to negotiate prescription drug prices, is we're seeing ridiculous spiking of costs. And that needs to be managed. And that's also throwing the system off, because a lot of the spiking of cost then ties back into our political system. So a lot of big pharmaceutical companies spend a lot of money in campaigns. And part of those investments on their part is to make sure they get folks who will say no to that question. But I do think that to meet the needs that we have in our communities and to bring down the cost of healthcare, we need to make sure that Medicare can negotiate. And again, it is fair as part of that negotiation. Part of what is factoring in is R&D. I mean, R&D is critical to all sectors. But a huge part of the cost of prescription drug prices right now are pharmacy benefit managers. They're not only driving up the costs, but also they are closing down mom and pop shop pharmacies across our state, across our country, especially in rural areas. And so there is the cost of pharmaceuticals themselves, but there's also the pharmacy benefit managers who have cornered the market and are really controlling some of the access financially, the access to it, and impacting our pharmacies as well. So those are additional areas we can reduce those costs.
Thank you, Jamie. You're doing great. We're getting there. And thanks to the audience again. Great questions. We have about 10 minutes left. So we'll keep going. Our next question is, so much of our healthcare is provided by low-paid workers in the home or peer support or counselors. How do we ensure that these vital workers earn a living wage?
Great question. And as I said earlier, it all starts with people. And so that's true for folks who are in our medical facilities. It's also true of our home care providers. And so making sure that we have, as I said, care for the caregiver. Those who are doing this important work to keep our communities healthy are getting the compensation that they need and they deserve, so that they can be providing for their families as well. It's all part of an integrated system. And when you're starving out folks who are providing the services, it's a non-functional system, or it's not a fully functional system. So we're looking at costs and where those costs are born is making sure, I mentioned before, the pharmacy benefit managers and some of the big pharmaceutical companies. We want companies who are making drugs to make sure they get adequate compensation so that they can provide the resources they need. But we need to really be shifting a lot of the investment in our system to those actually providing the services. And yeah, I'm really proud of the support I provided for labor unions. I'm a former union member myself. I was actually asked me, I was not in the healthcare sector, but folks who are standing up for working people and helping to make sure families are able to not just do their job, but also to care for their families. You know, I've heard stories that are shocking to me and should be shocking to others, that some folks who are actually providing healthcare do not have adequate healthcare themselves. That's outrageous. But especially those home providers who, this is an area we really need to be talking about more and bringing more attention to, because we actually are saving costs overall in the system by having people receive care in their homes. Those who go in and provide that work, that can be high stress work, that can be sometimes dangerous work, that can also, it's beneficial to our systems being functional. And so those doing that important work need to be fully compensated. And our systems, as we're looking at the investments and where the compensation is happening in our systems, it needs to be focused more on those doing the work, because as they're healthy and as they're able to provide, they're able to do the work that they love of caring for others, they also need to be cared for as well so they can provide for their families.
Thank you, Jamie. This next question will be our last question of the evening. It says, how can we include dental, vision, and hearing care without driving up costs even further?
Well, it's part of healthcare. And so the challenge to us is making sure it's part of our full discussion. We were talking before, even talking about Medicare. I think that when we're looking at healthcare, we're looking at physical healthcare, we're looking at mental behavioral healthcare, we're talking at vision, we'll talk about dental. So, if we can, by having a more efficient system, drop 25% of the costs, we can be allocating those resources to providing more services, including expanding services like vision and dental. We can also be making sure we're adjusting those to those systems to make sure we're adequately compensating those who are providing the services, making sure that they have manageable workloads so they can do their work. Those are where those investments need to be, because it's better outcomes. It's folks who are providing these services being able to provide better care and be cared for. And we also want to make sure that our taxation system is equally balanced, so people are paying their fair share. I've often said that taxes are the rent you pay to live in a civil society. And right now we have an unequal structure where there's some folks who are paying a lot more, and this is true of lower income and middle class folks, who are paying at much higher rates. and much bigger part of their income than some that are making a tremendous amount of money and have incredible access. So equaling out and balancing out that investment, our taxation system as well to a fair share model, and getting those investments in healthcare, and then stepping back again to public health overall, investing in education, investing in some of those other areas as well, so that we can provide healthy communities where individuals and families can thrive.
Good. Well, thank you so much for joining us. That was amazing. You answered so many questions. So thanks again. We did want to ask you if you would like to tell our audience how to reach you or your campaign if they have additional questions or comments.
Absolutely. So thank you again. Thanks for the great questions. Thanks for your expertise in this discussion. So it's Jamie McLeod-Skinner. I'm running for Oregon's 5th Congressional District. My website is jamiefororegon.com, and that's spell out FOR. It's not the number. And my email is jamie@jamiefororegon.com. But really welcome people to join us to move forward on this issue, but also on many others as well, to better serve Oregonians.
Well, thanks again, Jamie. Have a good night. And then I did want to let our audience know that we regret we did not have time for all of your questions. Remember, your registration for this series allows you to view all sessions of Conversations with Candidates 2024. Please visit our website at www.pnhporegon.com for the upcoming schedule and to learn more about Oregon PNHP. You may view recordings of this and our other sessions at our website a few days after each session. I now turn to John Stride, our City Club host, to close the evening.
Thank you. And thank you, Jamie, for sharing your thoughts and thoughtful comments on healthcare policy. We especially thank the audience for engaging in this important discussion with us and with you. And finally, we thank our co-sponsors, PNHP, for arranging this forum. City Club is engaged in its mission of presenting public programs, and one of those is coming up on Tuesday, April 2nd at 5:30. The City Club of Portland will host a webinar debate between 2 candidates for Multnomah County District Attorney, Mike Schmidt and Nathan Vasquez. And I encourage anyone who is interested to visit the City Club website at www.portlandcityclub.org to find more information on this event and to register for it. Membership in City Club is open to everybody. We encourage you to take us up on that invitation. So conversations with candidates will continue in the following weeks. On February 6th with Janelle Bynum, on February 13th with Maxine Dexter, February 20th with Lynn Peterson, and February 27th with Shushila Jayapal. If you wish, please complete the survey that follows the end of this program tonight. Again, thank you, Jamie, for your participation tonight and good preparation to participate. And everyone stay safe and don't get sick. Good night.